My name is Lotsy Dotsy. I am the resident clown here at DiMaggio Children's Hospital for almost 22 years. One of our doctors, Dr. Greisman, gave me a new title. He said that I'm the Chief of Clown Services now. He gave me a promotion. He said nobody stays a resident for 22 years. I always wore polka dots. I always used to wear dresses with polka dots and a bow with polka dots, everything polka dot. My neighbor came out one day, 6 years old, and she said, "You know, Miss Linda, you have lots of dots. You should be called Lotsy Dotsy." I was a respiratory therapist, and I loved my job, and I saw this little ad in the paper for clowning. I didn't like clowns when I was a little girl, but I wanted to know what it was all about, why I was afraid, and I thought it would be kind of fun, so I took the course. And the day that the end of the course, the little graduating class, we came here to Memorial, and it was fun. And the patients laughed, and one of the nurses said we had so much fun, just bubbles and magic and singing and talking and just hugging. I sat all the kids around a table in the playroom back in 1992. I asked them all, what would I do if I got this job as Lotsy? And Brandon looked up and said, well, you could take care of my mommy when she's sad, Lotsy, because she's always crying because I'm always sick. And I thought that was profound. He didn't care about himself at that moment. He wanted me to take care of his mom. I tell you, I was so blessed and so privileged that Mr. Frank Sacco allowed me to do this. He took a chance on me, and it was unheard of to have a clown on staff. I know I'm not a doctor, I'm not a nurse, and I'm not a social worker. I'm a respiratory therapist who took a clown course. And I loved what happened from the day I walked into the building. Lots of kids and families. And, they always say, you're working with the kids. Well, I work with the parents so much. It's unbelievable. I have to take care of those moms and dads before I can even take care of the child. That's my number one duty in my job description. Taking care of mommies and daddies. When you're taking care of that child, you're taking care of the whole family, and that's what we do here at DiMaggio. We all help each other. We have each other's back. When one's down, one brings you right back up. Sometimes when I'm walking through the hallways, I just say, good morning, or I'll start playing the harmonica, or I'll blow bubbles, or I'll give them a hug. And one nurse walked up to me one day and said, I really needed that hug you gave me, and you didn't even know what was going on in my life. The parents tell me all the time, oh my gosh, Lotsy, I'm so glad I came here. It was different, and it was like a family, and they felt that trust, and they felt that security. They know that they can trust us. You work with the people who can use you, and you can provide a service, and it's about just making them feel better just for a little while. Every day, I have to say that someone makes this old clown feel all good inside.